I'm not going to spend too much more time talking to you because we want to get you to be talking to yourselves and talking to us and enter into dialogue about what we can do to further our agenda and take us in the right direction of travel. But I want to just spend a bit of time reflecting on some key partnerships and levers, because I think what we've heard today, we've heard a lot of richness of data from my colleagues just now and this morning, and a lot about what Public Health England is currently doing and planning and developing to support and advise yourselves to tackle obesity. But there are other players in this field, and I'm going to use this next section to update you, but also to impress home how we're working with other organisations to try to make things better for yourselves and to identify the strategic levers and inputs to help us deliver. So obviously we talked about NICE this morning, and we're working with NICE on a variety of different things, as you'll imagine. They regularly produce robust scientific evidence, clinical evidence, to support the health community and the public health community now. But we're also working with them on that guidance, but also in terms of the work that Penny mentioned on with NHS England on weight management services. And we're also working with them on the review of the quality outcomes framework for general practitioners. But this slide demonstrates the breadth and the depth of the clinical guidance that I'm sure that you're all familiar with. I'm not going to go into too much detail because, again, a lot of it is out there. It's either developed and published for your use, or it's out for consultation. So, for instance, the guidance on lifestyle weight management for overweight and obese adults, that's currently out for guidance, for consultation. We're looking at it. We're going to consult back across PHE and report back to NICE. And if you've not done so, I'd urge you to go on the NICE website, to download it, review it, and enter into the consultation. There's a whole series of guidance that is out there for development and scoping is going to start very soon on the original obesity guidance that was produced in 2006. It's only a partial update, but it's going to be looking at two very important issues: very low-calorie diets and bariatric surgery, issues close to our hearts, I'm sure. And again, when that comes out, PHE will be involved with that, and would encourage you to get involved with it as well. And we're working with NICE to review how Public Health England can support NICE in that dialogue with yourselves. So there's a lot going on that aspect. Undoubtedly, we've talked a lot today in the morning session about schools, about them being a pivotal role for interventions, whether that's around health and well-being, around diet, around activity, etc. And, you know, as somebody who was there post-Jamie Oliver, 2005, I was on the school meals review panel. I helped to develop the school food standards, worked extensively with what was the School Food Trust, now the Children's Food Trust, on getting that organisation up to speed and the work that organisation continues to do to help schools to make schools a healthier place. So the Independent School Food Plan was published earlier this year. As somebody who's been intimately involved in schools and developing interventions for children and young people, it heartens me to see that we're continuing to move in the right direction. There remains challenges, no doubt about it. But the key thing here is that, food, education and cooking is going to be back on the curriculum. I think that we would all applaud that and welcome that. And that is an opportunity for us, because I'm sure that we'd all buy into that, to really push that work forward. And obviously in terms of the school food standards, they continue to be developed, and Public Health England's nutrition advice team will have a role in supporting DFE and the Independent School Food Panel on that. This morning there was a lot of conversations and dialogue about schools and their role, and it's fundamentally important. And as somebody who has worked to implement things into schools, working with key organisations and charities, I know that it's really important to get that senior leadership buy-in, whether it's the head teachers, the governing board, so I've worked with the National Governors Association before. We can't stress enough the importance of that, and I know that you all recognise that. And that's a key challenge for us in taking this issue forward. But, you know, importantly, school food needs to take on board what the kids want, and getting their input into these issues is fundamental. And as somebody who always built in young people's perspectives and views into everything that we did in Food Standards Agency, in the Department of Health, and now in Public Health England, then it's a really fundamental part of the picture. So what is Public Health England's role in this? What are we doing? Well, the Nutrition Advice Team, the Diet and Obesity Team, will be working very closely with the Children, Young People and Families Team to take this forward. And as you can see, this is quite a busy slide, but the things around it on the periphery are not things on the periphery. They're the centre of what the things that we have done in the past and what we should be looking to explore and to get back on the agenda again. Whether that's about the Something to Chew On programme with Premiership Rugby, which we trialled in 2010, and that rolled out across all the Premiership Rugby clubs and was really successful in getting kids more active in primary schools and also helping them to learn about those really important food life skills. This is something that the Premiership Rugby have got the funding now to roll out again, and so we'll be working with them on how that happens. But obviously, we've talked a lot about evidence. Evidence is really important. Public Health England has a role in supporting the school food plan on that. This morning, Jonathan talked about his role on the Health and Wellbeing Board, and we all recognise that there's more that we need to be doing to learn what elected officials and Health and Wellbeing Boards need from Public Health England to take this forward. And that's another aspect of this work that we'll be doing. And we'll also be looking at using the media mediums that are out there in terms of podcasts to get messages out there. And obviously, we've got Change for Life as well, which is the PHE's social marketing campaign, which I'm sure that we're all familiar with, and that will continue to be rolled out into schools with the school sports clubs, etc. And I think that will be really pivotal in sending out a coherent, cohesive message around school food and how it all ties in. But it's not just those sort of government, public health system organisations that we're working with. The Association for Nutrition is something that is close to the hearts of nutritionists who are registered with them. And myself, Penny and Sam are all registered with the Association for Nutrition. And, you know, it's an organisation that is going to be leading and advancing nutrition standards across the workforce. We know that it's not just nutritionists who are out there at the front line delivering messages, working with the public and families and children to help them to make those healthier food behaviour changes. And so the Association for Nutrition bidded for a Department of Health grant. Over 3 years, they developed this workforce competency model by drawing in lots of job descriptions for food trainers, community food workers, etc. And they've produced a competency framework. And on their website, there is a certification assessments available. So I'd encourage you to visit their website, to have a look, see it might not be at the right levels for yourselves, but your colleagues could buy into it. It's a minimal cost to register and to undertake the assessments. But I think it's something that's really worthwhile because capacity building, getting those skills, those nutrition skills wider in the workforce is something that I think we should all be looking to promote and to encourage. So the Association for Nutrition has a really important role, and Public Health England will be looking at how we can support them going forward. And that's all from me at this stage. And now I think it's over. I'll just hand over back to Marilena.